How was your journey to become CEO of Cereno Scientific?
Somebody told me when I was wobbling a bit, should I study medicine or should I stay? Should I take a PhD? And he said, well, you have some chemistry knowledge. Why don't you learn sales? And you'll be in the middle, so you can communicate between the worlds. I took his advice and called Astra and said, I'd like to work with you as a sales rep. And that's how it started. A couple of years later, I was called up by Chicago head office if I wanted to join them and become international product manager for a drug that nobody really cared too much about. $200 million in sales, 70% margin, nobody cared. So I was new, 29 years old, here's a telephone. And after 4 years, not being successful in convincing the head of R&D that we should do a survival trial with this drug that we had. I had been promoted to head of marketing globally, and I went to my boss and said, I'm paying it myself, we're gonna do it. And it ended up on the first page of Wall Street Journal later with my good friend, Dr. Alfonso Perez. The title was The Physician Who Didn't Take No for an Answer. I went back to Astra in '95, and I was suddenly in charge of the beta blocker, which is blocking adrenaline. I said, we got to do a survival trial with a beta blocker. Same kind of data, plus 30% improved survival. And now they're both used. A few years later, I was introduced to Cereno. 2014, they needed to improve or strengthen their board, I would say. Professor Sverker-Jan's idea, epigenetic modulation, prevent thrombosis without bleed. And I knew when I saw the team and heard the technology, this is big. It was like, I've been here before. So I was happy to join the board, and half a year later I pulled up my hand and said, I'd like to be the CEO and drive it, I know what to do. I've spent 8 years with Cereno. It's getting more exciting every day, actually.
Why is thrombosis such an important area for new drug development?
The biggest killer on the planet, thrombosis, is, coagulation in your blood vessels so the blood can't flow. So if you get a blood clot in a major organ, like your brain or your heart, the cells downstream die. Other companies have developed drugs for this. It's a $25 billion market. All the drugs that are used cause a risk of bleeding. So Cereno wants to improve the drugs, put out a drug there that can prevent thrombosis without causing bleed. If we can do that, it can be added to more or less all the other drugs and improve the efficacy so less people get thrombosis. It can also be used firsthand, hopefully, and be given to people to avoid causing the risk of bleed. Now, we have shown in our preclinical work that we can do this, prevent thrombosis without bleed in live mice. There's also data that HDAC inhibition and our substance actually has a less frequency of myocardial infarction and stroke if used for another disease. So valproic acid, the active substance in our drug, is used for epilepsy. It's been on the market for more than 50 years. And in stroke, thrombosis in the brain, the Scottish groups have documented the same thing, up to 60% less stroke if you use HDAC inhibition with VPA for epilepsy. So it looks like HDAC inhibition is preventing thrombosis. Now we have Mike Holinstat presenting CS014 here with that kind of data, with our novel HDAC inhibitor. So thrombosis is one very important long-term objective for us, preventing thrombosis without causing bleed.
Why is PAH such an important area for Cereno?
The other objective we have is to improve the prognosis and lives for the patients suffering from the very severe disease, pulmonary arterial hypertension, PAH. And we are pursuing documentation in a phase 2 study in the US. And the compound is CS1, it's HDAC inhibition. And why are we doing it in pulmonary arterial hypertension? We have documentation that HDAC inhibition is anti-inflammatory, anti-fibrotic, reduces the pressure, systemic or pulmonary pressure, and is antithrombotic and reverse remodeling. And interestingly, the new modalities in pulmonary arterial hypertension are aiming to be disease modifying. You want to not only reduce pressure, you want to change the direction of the disease, not to get worse, but to be reversed in the morphology. Merck Sharp and Dohme bought the company in November last year for $11.5 billion, Acceleron. The reason they bought that company is that they have a drug in development, now in phase 3, that is disease modifying. We believe that we have something of similar capacity at Cereno, and we are now in phase 2.
For more episodes of our Insight series, please follow Cereno Scientific on LinkedIn or our YouTube channel.